Well, it is time for our Local Heroes series. And today we have Maria Zubia with Kids First Healthcare as part of our Local Heroes program. And Maria and her team have been helping children and teens in Adams County for years and really have gone above and beyond the call of duty during this pandemic. And that's why she and her team are part of our Heroes series. And so, Maria, why don't you tell us a little bit about Kids First and who your clients are and where your clinics are, those kinds of things.
Yes, of course. And thank you. Thank you so much for this invitation. And, a big shout out to our frontline staff for all that they have done during this past year of, turmoil and challenges. So Kids First Healthcare is a pediatric adolescent clinic. It's a nonprofit, and it's been in Commerce City, where it started in 1978. And it was started through a grant with Adams 14 with the school district, where they had to come up with a way to really address health issues and education and how they intersect. And so they ended up creating this model. So we were the very first school-based health center in the state of Colorado, and one of the few in the nation. And so we've been providing healthcare services to children in schools since 1978, pretty much. And so I started in 2000, so I'm going on 20 years this month, actually. It's my anniversary this month, now that I think about it. It doesn't feel that way. But I know that in these 20 years, we have expanded. And we now have, besides the clinics that we have in Commerce City, we also have one in Westminster Public Schools at their Early Childhood Center. We have one at Thornton High School with Adams 12, and then we have one at Brighton High School with 27J. And so these clinics, obviously they're based in the schools. We do have 3 clinics that operate year-round, where we see children ages 0 to 21 at any of these 3 locations, the one in Westminster, one of the ones in Commerce City, and the one in Brighton. And the reason we can do that is because we have our own entrance and exit in the building. And so it makes it easier for us to be able to provide those services to any child from any zip code. One of the unique pieces of, or there's a lot of unique pieces that make up Kids First. And one of those is the fact that we have been mission oriented since the very beginning. We're mission focused, patient centered. Really, it's about the kids, what the kids need. And so over the years, we've provided and expanded a lot of our wraparound services. So part of my job, besides doing outreach, I'm the director of community outreach for the clinic itself, for the organization itself. But one of the pieces that I do that's different is I've been working since I started there on really trying to come up with a way to connect people to the basic needs, resources they need. And in order to do that, I need to really partner and network with others to find out what it is that they're offering and how that would serve our families best. And so it's just making those connections. I call it navigating, anytime we can navigate services for a family and help them get what they need, it really does provide a better, more equitable outcome for their student or their child, and for our patient. And so that's what makes it different. We have just a lot of different spokes in the wheel, and we all work together. But during COVID, as you know, it created a little bit of a challenge because the schools were closed, and the school buildings were not accessible, right? So we really had to come up with innovative ways to get the word out, that we were still here. We still are available to provide services either through telehealth or through in-person.
Yeah, I wondered about that because I've been to your clinic at Thornton High School, and I was wondering how you guys were, continuing to do your outreach and to continue to get your clients during this COVID. So why don't you go ahead and tell us about that?
Yeah. So the the ones that are truly inside the schools that don't have their own external entrance, we weren't able to keep those open, obviously, because the buildings were closed. So what we ended up doing, one of the innovative ways we had to come up with is the communication piece. So for a while now, we've had just a little bit of history of we've had a community advisory board for years, and we've had a youth advisory board since 2009, which I helped fund, helped create and have the honor of working with these youth and with the parents on our community advisory committees. And for years now, they have been saying that we needed to get our enrollment form, one pager, a consent form, online. We needed to have an electronic copy. Well, as you know, with HIPAA and FERPA, that's kind of interesting to kind of figure that out. These are the privacy practice laws that really, we all abide by. And so we had to come up with a way of doing that because people were not leaving their home, obviously, during COVID when it first shut everything down. And so that was the very first step we did. I ended up creating an electronic form that was HIPAA compliant that people could sign electronically and send to us. And so that we were still able to service their child, provide services for their child, even if they weren't physically present at that point. The other thing that
Go ahead. I'm sorry. I was going to ask you about your telemedicine, but go ahead.
Yeah. So the other thing we did was we needed to get the word out about telehealth and about the fact that we still had these 3 sites. Well, initially we had just the 2 sites, and then later on we opened up Brighton to be able to serve more folks. And so we ended up, we had to come up with a way to get this mass message out to our existing patients. And so we ended up working with a platform to do mass text. And so I was able to send a mass text to thousands of our patients at once saying, this is what the number, this is where you call, please, let us know if you need anything. And so we were able to do that quite a few times, depending on what message we wanted to get out. And one of those was for telehealth, to make sure that people understood and knew that we were available. So our text message platform was very successful, as it wasn't we didn't need to spend, because we didn't have the funding or the manpower to have everybody make, phone calls at that point. Like, one phone call per person or per patient was going to take a long time. So this really did help us get that message through to everyone around the same time, as opposed to, taking days. It took seconds to be able to just click and send it out. What's nice is I ended up doing an English and a Spanish. So every time we send mass text, we were able to send it. And we had to work very closely with our staff to make sure that our lists were correct, that, we had the correct information in order to do this. But once we got it, it really did help us get that information out. And then we have some of the most kind-hearted people on the planet, I think, because they, as soon as we knew this was happening, our medical providers and our pediatrician came up with, just the process for in-person visits and everything else that we needed, protocols for our staff to follow, and taking all the safety precautions that needed to be taken. And so all of that really did help us. Like I said, we are a person-centered type of organization. We're all about working with people. And when you take that piece out and say, oh, you still have to work with people, you just aren't in that person mode anymore. It just created that challenge of, how do we do this? Because, we still have that mission to abide by. And our mission is to serve children that are underserved in our communities and that need our services for whatever medical issue they may have or they may need. And the other part was too, is that we're huge on prevention. And how do you get the preventative care when you can't do, the physicals that you're used to doing? You can't get the shots because people are afraid to go and take their kids in there. So it's a lot of that education piece that we had to put out there as well, to educate families that, yes, you still need to follow through with taking your kids in to get their physicals and their shots, even through this time. And even more so, you want to make sure that, they have at least all the the pre-existing issues taken care of with these shots that we have now. And then, you know, later on, depending on what the powers to be decide around COVID for kids or COVID vaccines for kids, that would be another thing. But for right now, you know, we're really focused on getting that prevention and getting these kids updated and up to where they need to be, right? Because they have this, we have a lot of our patients are very thorough, like they are there when they're supposed to, they make those appointments when they're, but with COVID, a lot of them just, I mean, it was frustrating for them as well, I'm sure, to try and figure out, is it okay? Is it not okay? The other challenge we have is we don't have much space. As you have seen, our clinics, they're very tiny. And so our spaces are very small. And with, I mean, just knowing that we had to do that extra spacing between even our staff created a challenge, which meant we couldn't see as many patients as we were used to, and we couldn't allow as many people into those small spaces as we were used to. So every space in our clinics is being utilized within the proper protocol of spacing and making sure that our staff and our patients are safe. And so we had to get that word out as well and say, no, it's a, you know, we're doing all of these things to make sure that everyone is safe. But we have such a tiny space at our main office, because it's also our administrative offices, that one of the new things that I'm happy to report is that our executive director has been fundraising for us to purchase the 4th floor of the old human services building. And it's going to be like a community hub. So we're going to have, it's something that I've dreamt about having for years in this community, where you have like a one-stop shop for a lot of the services that people really utilize. So you'll have medical, hopefully, you know, with all the other folks in the building, you'll be able to get a lot of the other things that you need, such as WIC and Kind, Kids in Need of Dentistry. We'll have, you know, Cultivando's already there, UNA's there. There's just a lot of other organizations that will be there, and many services in one place is going to be such, like I said, just a godsend for some folks, because then you don't have to travel. As a parent myself, I would often say, why can't we just have everything in one place? Because I have 3 kids and I have to go back and forth to all these appointments. If there was one place that I could just go to and make my appointments, it would make it so much easier. Then I wouldn't have to travel. So, you know, just take off a whole day of work to go and take them was a challenge, especially when you live paycheck to paycheck, right? You don't want to take that extra day off. And that's exactly what our school-based health centers do already when the schools are in session. So prior to COVID, that was the whole point of having a school-based health center. Your kids are sick, right? Then and if they're enrolled in our clinic, they can make an appointment there and get seen. Now you as a parent don't take time off work to go pick them up, take them to the doctor, and then you just lost all day of work because you took them to an appointment where they may have just had a virus and they tell you, yeah, you know, keep them hydrated and send them back to school tomorrow. Where if you're at school already, the kids can walk in and say, I need an appointment, I don't feel well, and they can make their own appointment. And then at that point, you know, we need to do what we do, just like any other doctor's office. People often ask me how I describe school-based health centers, and the most visual way I can describe it is if you can imagine your doctor's office being picked up and dropped off in a school. So whatever your doctor's office does, you know, referrals, prescriptions, checkups, blood work, whatever, is what we do in our school-based health centers, which is totally different than school nursing, because school nursing is obligated by law. You know, it's something that's, you know, you have to have to make sure that the kiddos that have pre-existing conditions or need medications are being followed, or if anybody gets hurt in the school, that's a child that needs their care, they have someone. Where school-based health centers are that next level up, where you actually have a doctor's office per se in your school. And so that pretty much has been our model of working with our community for years. And it's really focused on our adolescent population when we're in the schools. And the reason we do that is because for when I first started anyways, we used to have some in elementary schools. But what I was finding is that most parents will follow through on physicals and annual checkups, everything, up until they no longer need those shots for school. And that's what, middle school, right? Once they no
Right.
longer need them, then we found that a lot of those adolescents were not getting preventative care anymore, because all the little siblings were, they're still getting it. They're still doing what but the middle schoolers and high schools, unless they did sports, they weren't really getting any of those, any of the preventative, what I call preventative checkups.
Sorry to interrupt real quickly, but we have about 4 or 5 minutes left, Ed.
Okay.
Oh, great.
All
Sorry.
Right. No. Thank you. So I wanted to ask you a little bit. So you did the texting and you did the outreach. What was the response of the community? And tell us a little bit about some of the people on your team.
Oh, sure. So the response from the community has been great. I mean, people are, they were calling in, they were excited to know that we were there. And we just, one of the things I did, I changed my outreach methodology, I guess, because outreach means you're out in person, right? Like you said, you're out shaking hands and telling people what you do. I, on the other hand, out there saying, come, if you know a child that doesn't have health insurance or has Medicaid and CHP and needs help, let us know. And I didn't have that opportunity. And so what I ended up doing is really networking. And I started participating on a lot of the committees. I participated on one of the most interesting committees ever, which is a model that I think we should follow. And it was through Adams County. It was the commissioners who got together and they created these teams of experts, people with the knowledge of the community, people who are experts in their area around whichever area they selected. We had 7 response and recovery teams, and I actually co-chaired the uninsured and health access team. And so we had one for early childhood, and we had one for seniors. I mean, there was just this fabulous bringing of, community that knew what they were talking about and knew what they were doing to come up with ways to provide solutions that were tangible solutions out in the community. And I think that anytime that there's a big issue that needs to be taken care of, this is the way it should be done. You should be getting the right players at the table, the person with the checkbook, the person with the decision making, and the person that knows their community, as well as people with lived experience. You have all those pieces together in one place. There's so much you can do. And I think that this model that they created was fabulous. And so that's part of what I did when I was doing my outreach, is connecting. But our staff, just so you know, we have our nurse practitioners make up most of our healthcare provider staff. And then we also contract school nursing to Westminster Public Schools and Adams 14. So those are the school nursing contracts. So it makes it easier for us to communicate as well with them. And then we have a Medicaid CHP Plus application assistance coordinator, and she really does help people to apply, renew, or troubleshoot any issues they might have around their health insurance for their kiddos, as well as helping them with food assistance or anything else. We have health educators that will help families understand what the provider is saying when it comes to like asthma plans or anything else that they might not understand. The health educator could come in and work with you. And they also help with connecting them to some of those basic resources that they may need. Oh, here's the phone number for rental assistance. Here's the phone number for, or let me give you a referral for clothing. I mean, there's all these other things that our staff does. And we're a very lean staff when it comes to admin. We have 7 managers pretty much that are doing and wearing multiple hats, let me tell you, and just trying to get all of this good work done. But it's really our front office staff, our medical assistants, and our health educators and our providers who are doing the majority of the work, because they have been putting themselves out there since the very beginning. When COVID people didn't understand a whole lot about COVID. Our staff was still there providing these services, and regardless of whether they were exposed or getting exposed, they just were there for the betterment of the community. So it's been amazing to do all of this work. I didn't disclose something to you though. I have to disclose it first, and I'm sorry about it. I am doing this interview and I'm talking to you all in this setting, but I am wearing my Maria Zubia Director of Community Outreach hat and not my school board Secretary of Adams 14 hat.
Right.
I have to disclose that all the time. I totally forgot to disclose that. So I just wanted to disclose that.
We understand that. And I, I mean, you spoke in such a way. You're so proud of your team and the people that you provide services to. And you guys did it really in kind of unknown setting when we ran into this pandemic. So that's why you and your team are heroes and part of our Local Heroes series. We just thank you for the service in this very difficult time. You guys barely, you figured it out and you did it. Like you came up with that whole new texting platform, and all your providers were prepared to make different arrangements to make sure people were safe and healthy. So I just want to let you close, Maria, after you've done your disclosure now, and just say thank you to you and to Kids First, and let you close it out.
Well, I want to thank you again for this. It's been our honor to serve our community for so long. And if anyone has questions or would like to help us get our expansion so that we could serve more kiddos during this time, please look us up on kidsfirsthealthcare.org. And you're welcome to contact us at 303-289-1086.